All right, in this first section of lecture, I'd like to talk to you more about health behaviors, how they're defined within health psychology, and why they are so critical to this field of study. So we talked last time about how we've shifted in our thinking about the relation between mind and body and how that underlies disease and health over the years, and how we moved from a biomedical model to currently a biopsychosocial model. And we left off with talking about how these disease patterns have really changed over time because of that. So with the inception of the biomedical model and inventions of penicillin and vaccines and antibiotics, we saw that people were dying less and less of communicable diseases and things like tuberculosis, and living longer and having time to accumulate damage to the body. And so now we see a disease profile of people, of the leading causes of death being these chronic illnesses like cancer, heart disease, and cerebrovascular disease. And another key piece here, that when we look at this profile of diseases and illnesses and causes of death, that many of them do have behavioral components or factors that contribute to these diseases. And so, again, I'm not saying that cancer is always caused by your behaviors, but there certainly, for some types of cancers, are behavioral factors involved. For example, lung cancer having a major risk factor of smoking. That's a behavior that we engage in. Heart disease can be related to diet and exercise. And so it's really important as health psychologists to start looking at the biological and psychological and social factors that lead to people engaging in these behaviors or not engaging in these behaviors, so that we can promote better health. So we're going to talk more about that today. So just a few more key definitions that would usually come from a textbook, but again, you know I don't really like the textbooks, but these will be useful in the course and just organizing what we're thinking about. And so within treatment and prevention of illness, we can think about 3 levels of prevention. And so the first is primary prevention, and this addresses all of the health-enhancing efforts that we might engage in to prevent or avoid disease or injury. So things like wearing seatbelts, eating healthy, exercising, not smoking, flossing, getting immunizations. And so these are really considered many of the health behaviors that we're going to cover in this course. But there's also secondary levels of prevention, and so these would be actions that you take to identify and treat an illness or disability early in its occurrence. And so this could include things like monitoring symptoms, taking medication to treat an illness, following treatment regimens, and this would also cover things like health screenings, right? These don't prevent you from getting sick, but they help you to detect that early and be able to treat that. And so these are secondary health behaviors and secondary treatment protocols. There's also tertiary level prevention, and this includes actions that are taken once damage of the disease or disability has progressed more significantly. And so this might include things like physical therapy, managing pain, chemo and radiation in order to treat later stage cancers. And so we will address all of these levels in this course at various points. We're going to start with talking more about these primary and secondary health behaviors, like health promoting behaviors and getting screenings. But then later in the course, when we get to talking about pain and chronic illness and end of life, we'll be talking more about these tertiary prevention measures as well. So again, we're starting here with more of this primary and a bit of the secondary, right? We're really concerned about these health behaviors that individuals engage in to help prevent them from getting sick and to promote their health and wellness. So just to give a few more definitions in this area, I think these will all make pretty good sense to you, but to give the official definitions, a health-promoting behavior, these are all the activities that we perform to maintain or improve our health. So things like exercising regularly, using sunscreen, healthy eating, practicing safe sex, wearing our seatbelts, all of those things. And so often when people are talking about health-promoting behaviors, they might just call them health behaviors, but that might also include, there can be health risk behaviors or negative health behaviors, and these are all the things that would be compromising towards health. So things like smoking, excessive or unhealthy eating, substance abuse, dangerous driving, risky sexual behavior, and more. And so health psychologists are concerned about promoting more of the health-promoting behaviors and helping people to helping people to refrain from engaging in health risk behaviors. And then as sort of a subset of health behaviors, we also have health habits. And these are the health behaviors that are firmly established, things that we regularly engage in and even perform without full conscious awareness, right? We might be able to be conscious of that if we were to reflect on it, but we sort of engage in those habits without really being fully aware of them in any given moment. So these could be like habits like biting our nails, or the fact that there are people who, they don't really have to think about the fact that they're going to go running every morning anymore, because that's a habit that they've established, or it's a habit to start the day with a healthy smoothie or something like that, right? So these are health behaviors, but ones that are firmly established. And these can also be negative things as well. Maybe you have a health habit of smoking, but that's a negative health habit. And so health psychology, again, also wants to find interventions to help us turn our health-promoting behaviors into habits and to prevent our health risk behaviors from becoming or staying habits. So thinking about some of these health behaviors, what are they? I think you all have many in mind already, but if you're going to do the health behavior assignment, you might want to think of some that are applicable in your own life, things that you do engage in, things that you don't engage in, things you wish you engaged in more, things you wish you engaged in less. So some of the key ones, and these have some guidelines here that come from various health agencies, but some of the basic ones are: do you exercise 3 times per week for at least 20 minutes, drinking 8 cups of water per day, consuming fruits and vegetables 5 times per day, consuming more than 5 alcoholic beverages on 12 or more occasions in the last year. This is a negative risk behavior. If you didn't guess, this is not a goal that we're setting for ourselves here to drink this much. Sleeping at least 7 hours a night. This might be a little triggering for students, right? I don't think many of you get this. You all work very hard, but ideally we're all getting 7 hours of sleep per night. It's hypocritical for me to say this too, of course. I don't achieve this either. Wearing sunscreen regularly if you're going outside, something that we used to do. Flossing daily, another health behavior. We often forget that our teeth are part of our body and part of our health because dentistry is so separate from the rest of healthcare. But flossing has a relation to heart disease and all kinds of other health outcomes. And not smoking is also a major health risk factor. Smoking is a major health risk factor. Not smoking is a good thing. So thinking about what you do on these various things, right? So many of us, myself included, don't achieve many of these sort of basic standards of positive health behaviors. And so there's one study looked at this across Canada recently. These data come from 2017, and they looked at 4 of these major behaviors. They looked at engaging in moderate to vigorous exercise for 150 minutes per week, not consuming that much alcohol, not smoking cigarettes, and consuming fruits and vegetables 5 times per day. And they, the way they operationalized this in this study is they just had participants say yes or no whether they met these. So, and the way they score this, I'll use myself as an example. No, I don't engage in that exercise. This will actually be my health behavior goal for this term. I'm going to do the assignment alongside you. I need to add this back in. I know all the benefits, and so I need to do that, but I don't do that currently. I don't actually drink all that often, so this one I do achieve. Don't smoke, but I definitely also do not consume fruit and vegetables 5 times per day for a number of reasons. Some of them actually are health related. I'll talk a little bit about those in our autoimmune lecture. But so if I were a participant in their study, my total healthy behavior score would be 2. You get 1 point for each check mark you get each time you say yes. So based on this, I'm clearly better at not doing things than doing things. So I only get a health score of 2. Your score can range from 0 to 4 in their survey. So they looked at this across Canada, and what we're looking at here in this figure is the number of males and females who scored a 0, a 1, a 2, a 3, and a 4. Females are red, males are in blue, and so you can see that most Canadians are scoring a 2 or a 3 on this. So this is not terrible, but certainly there's a lot of room for improvement. Most people are not nailing all of these health behaviors, and there are also a significant number of people. Right? This is still 15% of males are are only engaging in one of these health behaviors, and so we really do want to try to find ways to help people be able to engage in these, because they've, as we'll see throughout this course, these health behaviors do have important predictive outcomes for long-term health. So we know we should do these things, right? I'm teaching this class, I know I should exercise, I used to exercise, but why is it so hard to change our behavior? Almost every term I make this goal, this time I really am going to stick to it. I'm going to tell you this so that it helps to hold me accountable, but why is it so hard to change our behavior, right? This is where psychology really can come in and help, right? And part of it, and we'll talk a lot more about all of these things throughout the course, is that a lot of these behaviors are pleasurable, automatic, or addictive, right? So with smoking as the example, right, that for smokers it feels good to smoke and it becomes an automatic habit, and it's that one in particular is physically addictive. But even for things that don't have a physical component to the addiction, with chemical addiction, behaviors can be addicting too. We can become behaviorally addicted to things where we get into the habit of something and this becomes a calming habit for us, and so we then continue to need to engage in that, and that can be all kinds of unhealthy behaviors like binging Netflix instead of getting any exercise. This can be eating unhealthy foods, and so it's really these things are enjoyable. It feels good to eat half a bag of Oreos. Maybe it doesn't feel good later, but in the moment we do derive some pleasure from that. Also, it's automatic in the sense that, often we're not even aware that we're doing things, right? Particularly when we have other media on in the background, we may not be fully conscious of, for example, how much we're eating or what we're doing in any given moment. There's also often little immediate incentive for good behaviors, right? The payoff for working out comes over time. You don't usually feel all that great after the first few times. Maybe you do with an endorphin boost, but often you're sore, you're tired, and you might feel good about yourself for engaging in that goal, but the immediate incentive of potentially watching your favorite show on Netflix can be more rewarding and make it hard to want to stick to those long-term goals. Taking a nap, right, the rewards of that are more immediate potentially. Often, but not always, these behaviors are related to one another. So that study that we looked at didn't look at sleep, but that's a really key health behavior that interestingly is not covered in many of the health psych textbooks, but is one that we'll definitely talk about in this course, because sleep is strongly related to all of these other health behaviors, right? If you're exhausted and not getting enough sleep, it's really going to be difficult to have the energy to exercise. It's also going to interfere with your self-regulation for engaging in other types of health behaviors, or refraining from engaging in risk behaviors. So sleep is really key, and so this can interfere with other health behaviors too. Health behavior is also controlled by multiple factors, right? There's individual and social and cultural differences that can come into play here, so there's not just one or two things that are impacting people's health behavior, so it can be difficult to come up with interventions, for example, that work for a broad array of people. And again, this is where health psych really can be beneficial, right? We said last time that we look at biological, psychological, and social factors. There's many different factors that influence health and health behaviors, and health psych looks at these. And so for health behaviors, right, they might look at things like your genetics that play into this, some of the hormonal influences. We'll talk about this a lot with the hormones that regulate hunger and eating in some of the later lectures. Neurotransmitters certainly matter here, and that's related to genetics as well as other factors. Also, the symptoms that people are currently experiencing influence their engagement with health behaviors. Often we are more likely to do the healthy thing when we are currently experiencing a negative symptom. Studies have shown that smokers who have a sore throat, even if it's not related to the smoking itself in that moment, cut back on their cigarette smoking more, because it makes them more conscious of that effect that's having on their throat and lungs. But at the same time, really severe symptoms can make it difficult to engage in health behaviors if you're experiencing pain, and so this is going to be an important factor to look at, and we'll do that throughout the course. Psychological factors, of course, this will be deeply embedded. We're going to talk a lot about motivation in our next lecture, people's Beliefs about health matter. We'll talk about that in this lecture. Emotions certainly matter, how we feel about different topics. Attitudes, and this is related to emotions and beliefs, and personality also moderates this as well. And so there's psychological, biological, but then also social factors. The amount of social support that we have and the size of our social networks are key in influencing health on behaviors as well as health outcomes. Norms and values matter. What we value will influence the kind of behaviors that we engage in, and the norms of those around us will also influence us. Our access to medical care is going to be really key. So that's going to be something else we're going to talk about in this course. As well as access to other resources, right? It's going to be difficult to engage in positive health behaviors if you can't get to a gym in your area, or there's no fresh, healthy food to buy, and you're not able to access that. And so those are going to be key things as well. And so related to that are also going to be socioeconomic status and education, which are, of course, related to one another as well. And we'll be looking at those throughout the course and trying to disentangle what are the factors involved in that make it more difficult for people to engage in these health behaviors when they have a lower socioeconomic status. And often this is going to be related to lack of access to other resources and just also the other stresses that low-income people are under. Just for one example here, going back to that study that we talked about previously, looking at Canadians, and they looked at them across many different provinces. And this graph is breaking down that same data, but by level of education. And we're seeing this is the percentage of people within each education level that had a healthy behavior score of 3 or 4. So we're quite healthy, healthier than me. And what we can see is that a greater percentage, about 50% of people with a post-secondary certificate or a university degree are engaging in these higher levels of health behaviors or more positive health behaviors, and that's more than people who have less than a secondary school graduation. And so I'm not showing this graph to say that, less educated people don't know what they're doing, but this is an important finding in the sense of we can see that there is something going on here, and one of the things that health psychologists do is dig more into this and see, so what is it about less educated people here? Is it that they have lower SES now, they have less access to resources because of where they're living, and then wanting to address those factors so that we can help increase the health of everyone. And so this is something that we'll look at throughout this course. And so what's interesting is, we talked about primary prevention and secondary prevention, and those are interesting terms because otherwise so far we've been emphasizing that health psychology is really about wellness, and really it's more than just an absence of illness. And so that really indeed is the goal of health psychology. I think it's just an interesting thing that the terms are called around prevention. I think that's kind of a holdover of the biomedical model, but we also really want to emphasize in this course health promotion, and that we really want to emphasize the ability for people to be able to increase control over and to improve their own health, right? And that's what we would want to be looking at in that last graph that we showed, is what is preventing people with a lower level of education from engaging in these health behaviors, and give them the tools that they need and the resources that they need to be able to take control over their own health. And so we'll look at a variety of interventions that might be helpful in that, from everything to individualized interventions to equip people with specific skills, to providing a basic income so that people have time and resources to think about their health rather than trying to scrape by. And so a key statement in this is that wellness is a personal and collective achievement. And what I mean by that is that we often think of wellness as something that we do for ourselves. It's an individual thing, and that's how the health behavior assignment is structured, right? You change your behavior, and you set a goal, and you come up with a plan to engage in that. And that is an important way that we can improve our health, but also our society and the way that is structured it has important impacts on health. And that's something we'll also definitely cover in this course. And so it's a collective achievement in the sense that we need to create the conditions that allow people to engage in these personal actions that promote wellness. And so having those opportunities and resources and incentivizing things properly. And often one of the arguments used for this is that health promotion at least in many studies, appears to be more successful and less costly than disease treatment. And so this is very often the argument for creating more programs in schools and workplaces, wellness programs in organizations, is that this will save money down the line, right? If we help people to take care of their health now, then they're going to be less likely to need long-term treatment for these chronic illnesses. I put a star there because there is some competing data there. This is a really hard statement to provide evidence for, because you need to look over a long time to get that evidence, and so it takes a really long longitudinal study to get this data, and so some studies have shown this to be true, some have shown that it's not, but I think an important point is that regardless of the actual cost of this, people's health will be better, and so the human cost is going to be positive here. People are going to have higher quality lives if their health is better, and we take care of that, and we prevent them from getting sick in the first place rather than treating that afterward. Right. So we will stop this section here, and then I will pick up again with talking about theories and cognitive models specifically.